I want to thank and welcome the other co-chairs and their staff, Senate Republican Leader Bucco, Assembly Majority Leader Greenwald, and Assemblywoman Dunn. We also want to thank Senator Paul Moriarty's office is with us today, Assemblywoman Yvonne Lopez, and Assemblyman Anthony Varelli. So now I'd like to turn to you, Senator Ruiz, to get us started. Thank you.
Good morning, Mercedes, and thank you. I also want to recognize my colleague on the Senate side. I see her here looking beautiful in her red or hot pink. Senator Angela McKnight is also joining us, a member of the Education Committee, which is clearly important to have individuals who work on policy really get an opportunity to listen to experts in these spaces. I see Maxilia from the office of Assemblywoman Shanique Spate, and I know I'm getting in trouble here because I can't see everyone's box, but I wanted to recognize some of my colleagues who are on here. Good morning, everyone. And thank you for joining a place where I will tell you that every time I get on with staff, I have an opportunity to learn from experts. I think oftentimes when we create policy, we lose the lens of inclusivity, not intentionally, but because we're not thinking about how other people think and how other people perform. And I will tell you that this caucus has helped me consistently guide me with education policy to be sure that children and adults in different spaces who learn and operate differently than we do, make sure that they also have a seat at the table and that we're inclusive in our approach. So that is the only thing I will add. I'm looking forward to hearing and learning. My camera will be turned off because I have to manage 4 things at once today. I hope to see some of you. Oh, I see Assemblyman Eric Simonson has also joined us. I'm going to be with him in Atlantic City tomorrow for a school board panel, and I'm sure special ed and disability issues will come up in our conversation. You know, clearly, the one thing that I've consistently said is in many different spaces, as a budget member, you always hear from the parents when children are aging out of programs. And I will have to tell you that I drive home brokenhearted consistently every time. I don't think this is unique to New Jersey. We do not have enough wraparound programming for aging adults in spaces when their parents are thinking about wills and end of life. And it is extraordinarily scary. I sit there and I'm not experiencing those moments and I walk away filled with fear. We have to do better in the state. We must do better in this country. And then the second thing that I always found one of the most impactful lessons that I learned as the chair of the Education Committee, and I don't recall what subject matter it was clearly, and maybe it was when I was creating the ombudsman's office for special ed, and we had such robust testimony. Families with students in school districts, they had 3 options, which was, I don't understand exactly what's happening with my IEP or my 504. And so the child wasn't getting everything that they deserve by their constitution. And not because the family didn't have their wherewithal, but it's just capacity of life, right, in dealing. You had the one parent who gave up their career and became the advocate for their child. And then you had the third family that was more resourced and had hired an attorney. That is not a structure that works. A system that works respects, supports, reinforces, encourages, and above all, protects those most vulnerable in our systems. And so I would leave you with that, and I look forward to listening and hearing. Mercedes, in the event that I have to, if it runs a little long, I know I'm not have wrapped up sentiments. I do have staff here. You know, anything that we need, if you can't get me, reach out to Erica. She's on the call on here somewhere, or Ashleen in our office. And I will tell you this, it has been an honor to serve on this for some time. And something that I will tell you that I did learn this from our former Senate President, Steve Sweeney, his commitment in this space. Just because we lose colleagues of that nature, know that you have individuals like Yvonne Lopez and Senator McKnight and myself and Simonson and Avi, who's on the call, I see him now too, that we're committed to making sure that our children get and need what they are due to them. So thank you very much.
Thank you, Senator Ruiz. And as you speak, I am just more energized at how important and valued you are and the other caucus co-chairs are in this space. You speak so much on point to what families and individuals need to hear about disability issues. So thank you for your role and for your leadership. And we know you have 4 things to juggle, and we're gonna move along. There are some other people. You're right, the screen is hard to follow, but I do see Assemblywoman Matsakotis here. So I want to say thank you for joining us. Senator Vitale, thank you for being here. And I think we also saw Assemblyman Simonson and Jenna Lopez from District 11. So lots of folks on today's call, and we're going to get started. First up, I'll let you know that we're going to break up today's session slightly into 2 segments, 2 separate areas, but they absolutely come together because we are talking about our children and our families in this space. Our first segment will focus on an educational opportunity to learn about dwarfism. We want to welcome Dr. Angela Verato, who is a pediatric endocrinologist at Mount Fiore Medical Center in the Bronx. Until this past January, Dr. Verato practiced at Robert Wood Johnson Barnabas Health, at Cooperman Medical Center, and within the pediatric subspecialty group at Children's Hospital of New Jersey at North Beth Israel Medical Center. She was also a clinical assistant professor at Rutgers Medical School in Newark. Dr. Verato, we welcome you, and we turn over to you.
Hi, everyone. I want to thank Senator Majority Leader Ruiz, the co-chairs, and all the other members of the Disability Caucus, as well as Mercedes, for allowing me to bring awareness to October as National Dwarfism Month. I am a pediatric endocrinologist, so I care for children with various rare bone conditions. I'm also a Westfield resident and a mother of 2 young boys, one of whom is actually undergoing an evaluation for his own growth issues. And we heavily rely on New Jersey's early intervention for his delays as well. So I want to talk to you a little bit about dwarfism. So that is an umbrella term that kind of talks about conditions that are either, genetic, medical, that are going to impact a height. So the average height of an adult with dwarfism is 4 feet. But typical heights can range anywhere from 2 feet 8 inches to 4 feet 8 inches. In the United States, the incidence of dwarfism is 1 child per 10,000 births, or around 400 births a year. The most common type of dwarfism is achondroplasia, which is reported to occur in about 1 in 15,000 to 1 in 40,000 births. The estimated prevalence here in New Jersey is about 402 patients. So achondroplasia is due to abnormal cartilage formation, which is in the growth plate, which can lead to abnormal formations of bones in the skull, as well as long bones. There are other forms of dwarfism that can be in conditions that impact the structure of the bone, not necessarily at the growth plate. There's actually over 400 known types. Some we have known genes that are associated with them, some not, and some are, really rare and, isolated to a few families. Other forms of dwarfism can be seen due to hormonal deficiencies or hormonal resistance. So in patients who have growth hormone deficiency, or patients who have Turner syndrome, and you'll be hearing a little bit more about Turner syndrome later. There is estimated to be 277 people in New Jersey currently living with Turner syndrome. Now, when it's due to hormonal deficiencies or resistance, these patients may respond to medications like growth hormone and may achieve a height that is closer to average stature. But again, recognition of these conditions and timely referral to specialists is important for that to happen. One thing to note is with dwarfism, right, short stature is the defining feature. However, there's a wide range of other medical issues that may occur depending on the underlying condition. And so there's going to be a wide range of disabilities and need for medical care. So this isn't a monolith. And so, each patient's journey is going to be a little bit different. I really do emphasize the importance of early diagnosis for management and possible therapies. Many children who have dwarfism are born to parents of average stature who may not realize the challenges that their children may face. So it's really important for them to have that village in place to allow them to navigate challenges. So, for example, I have patients that are now becoming teenagers and they are going to take their driving test. Well, they need to see an occupational therapist to figure out the appropriate, assistive devices that they need to be able to drive their car and take their driving test. Or, some children may have difficulty with toileting habits. And so there are things, devices that can be used to assist the patient, assist the family, because ultimately, many of these patients are going to want to have some degree of independence. I think, something that can be a real challenge is being able to get into these therapies in a timely fashion. As someone who engages in the system, I can tell you firsthand, there's often really long wait lists and out-of-pocket costs to be able to get the therapies that a child or a young adult needs. And this can leave families in the lurch and missing critical times in development, right? So if there's a 6-month wait list, but we know, that 6 months is such a crucial time to help the child get on track, stay on track, that really can, put families at a disservice. I remind myself every day how lucky I am that I have been able to shape the career that I have to be able to afford this burden of care, and then also just have a career where I'm able to take my son to appointments. And I know that that is not something that all families have the luxury of doing. And so I do think it creates some inequality in access to care for families. I think another important thing to bring up as part of National Dwarfism Month is the patient experience, right? So, I talk to my patients, I talk to their families, and I always ask them, what are things that you wish that people knew? And one thing that, a lot of families talk about is, how their child is perceived, right? So if you are smaller than your peers, people may think that you are younger than you actually are. And especially in the school system, right, that can lead to some issues if you're in 5th grade, but everyone treats you like you're a kindergartner just because of your stature. And that can lead to some issues with peer groups. Another common concern is that patients, feel that others view them as being helpless or having an intellectual disability. Now, again, achondroplasia being the most common form of dwarfism that we see, most of those patients don't have any intellectual disability. And so because outwardly they may appear different, people assume things about them. And again, they may feel like they're getting talked down to or, being treated younger than they are, which can have profound impacts on their interactions with their peers, interactions with their teachers, and overall self-esteem. So I don't want to take too much time because I know there's a lot of great people that want to share their stories. But again, I just want to thank everyone for taking the time to learn a little bit more and, get some insight as to some challenges that patients may face.
Thank you, Dr. Verado. And we are lucky to have you having taken your career into this space. And we appreciate that. We also appreciate you introducing us to our next speaker, Kim Hall. Kim Hall lives with Turner syndrome and has been a volunteer patient advocate for Turner Syndrome Foundation for about 14 years. So Kim, we welcome you to share a few words today as well.
Hi, my name is Kim Hall. Thank you for the opportunity to share my story. From the time I was diagnosed at the age of 16 with Turner syndrome, my family taught me to be strong, be my own advocate, and be heard. And truthfully, not everyone with Turner syndrome or other disabilities can be their own advocate. We do not always have the attention, emotional energy, or physical ability to find the services we need. Sometimes our energy spoons are just all empty. With Turner syndrome, because I look different, I'm treated differently. It can be emotionally, socially, logistically difficult at all ages to live with a disability like dwarfism. As a little person, the challenges started even before I had a diagnosis. It was tough being bullied as a child in school. I come from a large family, 7 kids, and lots of nieces and nephews. I was the first to go to college. The transition from pediatric to college age services was difficult. My parents had no experience in helping me find the services I needed. I got some help with extra times on test, but I needed more. While most colleges do provide some physical and emotional support systems, you have to know what exists and also be in an environment that you feel psychologically comfortable asking and taking advantage of them. As I grew older, I started to look for work. People saw me as someone young because of my height. They didn't see my experience and my maturity, and it became another challenging transition. And the simple things you need to do to remain independent like an adult and that most people take for granted, like reaching for something in a grocery store or even driving, can be really difficult some days. Things like Uber and Lyft can be a big help and used as assistive devices, but costs can be a problem for a lot of people. Programs like Medicaid managed long-term services and supports, MLTSS, have really helped me once I was able to find them. One of the hardest parts of having a disability like Turner syndrome is knowing what services exist and how they can be accessed. It's so important to recognize that things are a lot better now than I was growing up, but I would still struggle and find it mentally draining to figure it all out. My county has community outreach services. They do it every year, but it changes every year, and it's really hard to keep up with. Those with disabilities need some place we can turn and to help navigate the services that the state provides. The state offers lots of services that can have a big impact, but I do not think Turner's or Dwarfism community in general always knows where to look, what to look for to get the help they need. Easily accessible care management services that are well publicized would go a long way. To be effective, though, these services must recognize the needs of people with disabilities are different, even for one person. Those needs can change sometimes day to day. Earlier access to services is essential, but I also know my lived experience would have taken me down a different path had I been diagnosed earlier. Things may still be very challenging, but I think they would have been easier. Turners can now be diagnosed at birth and then before birth and confirmed after the baby's born. Early diagnosis can lead to better health outcomes, both physically and psychologically. Getting a diagnosis of Turner syndrome early might have allowed me to enroll in clinical trials like for growth hormone, which is the only medical medicine approved for Turners. Now there are new therapies being studied that are intended to treat underlying genetic cause of Turner syndrome. But the current treatments and those we hope will come soon will only work for someone with dwarfism if taken as a child before they're both plates close, and that's usually about 13-ish. So early diagnosis is key. What I really hope for is the next baby and parents living with the diagnosis of Turner syndrome and other forms of dwarfism or any kind of disability will have it easier than I did. The ability to diagnose early exists, and many services are now available, but we need more awareness to help these families navigate these challenges throughout their lives. This is why celebrating Dwarfism Awareness Month with the educational opportunity is so meaningful to me as I advocate in behalf of patients like me. Thank you for listening and for the important work you do in support of the dwarfism community.
Thank you, Kim. Thank you for joining us today. Thank you for bringing your personal story and sharing that with us. The legislators here, their staff listening, I do believe you've made an impact on, and not just in hearing your story, but understanding more so than they did earlier today. Senator Ruiz, did you want to comment? I saw you come up.
I want to thank you, Kim. I know for many of us here in elected capacities, it is always inspiring because you've turned around your experiences to advocate for children yet unborn, and I'm grateful for that. It happens often where people think that their experiences have happened recently in a committee, and I told someone, I said, don't think that it was just for nothing. You're here fighting the good fight on behalf of daughters who are yet unborn. So I appreciate you, and I hope that this process does get better. I know with your advocacy, it will.
Thank you. I think while we were listening to Kim, I wanted to welcome Senator Corrado, Senator Singleton, Assemblyman McClellan, our newest member of the caucus, and Assemblyman Avi Chanel. Thank you for joining us. So we're going to move into our second segment. As I mentioned earlier, that we had two segments today. This second segment focuses on the use of restraint, seclusion in schools. That continues to be a critical topic of discussion concerning students with disabilities. And while seclusion and restraint are sometimes considered as necessary interventions to managing certain behaviors, these practices do raise significant ethical, legal, and psychological concerns for our students and grave concern for families. There was bipartisan legislation sponsored by Senators Corrado, Zwicker, and Bucco that passed in 2018 that made improvements in New Jersey, but we know that more work needs to be done. And we are very fortunate to turn to our next speaker to talk us through what still needs to be done. It's a privilege for me to introduce Peg Kinsel. Like you, I learned so much when Peg can set the stage on an issue like this and be a champion for many students with disabilities. Peg spans parent advocacy, Parent Advocacy's Public Policy Director and Chair of the New Jersey Council on Developmental Disabilities, Children and Youth Subcommittee, where they are always hard at work. I witness Peg in action all the time. Peg has led the charge at NJCDD and SPAN in being the voice of quality education and experiences for students with disabilities. We're fortunate to live in New Jersey when we have Peg advocating for students. Peg, I turn to you.
Well, thank you very much for that kind introduction. I appreciate it, Mercedes. I'm going to first take a point of privilege and apologize for being in my car, but that's the way things go sometimes. And the point of privilege because of the timeliness of this, I'm in my car because I just left a funeral for a friend's daughter. Her daughter was 36 years old, had autism, some other issues, but I say Stephanie's name today because Stephanie's the one that started me on my journey against the use of restraint and seclusion in schools and anywhere else for that matter. when Stephanie was just a little girl. It was the first time I witnessed the use of restraints on a child. And I was horrified, and I assumed nobody must know that this is happening. So in my naive nature, I went to talk to our assembly person, who at that time was Joe Malone. And that was the very first time I actually testified at the State House, was when he was chair of the Education Committee, because I couldn't imagine in my wildest dreams that people knew what was happening to these little ones. That was close to 30 years ago, 28, I guess it was exactly. So the journey continues. In Stephanie's name, the advocacy continues. But what I need our legislative partners to understand is the trauma that this visit is on both the student, the family, and any of those that love them. So please remember that as we still try to strengthen our advocacy around the use of these techniques. Now, I did want, first of all, to applaud the majority leader, as well as the other sponsors of legislation that started to include the data on the use of seclusion and restraints in schools. We, up till then, besides U.S. Department of Ed, Office of Civil Rights data that's collected biannually, we didn't collect those numbers. And Senator Weiss, when she was drafting her bill around understanding demographics of discipline, she was willing to talk to us and include data on restraint seclusion. This year, we got our first data. And although it was very exciting for all of us, we think there's some fixes that need to be made. I, refer you, of course, to the report from the Commissioner of Education to the legislature on discipline. And even though the department doesn't recognize seclusion and restraint as discipline, it was important for us to get an idea of what the numbers are and where the representation happens. So none of you, I guess, will be surprised that in seclusion and restraint data, the overrepresentative population is students with disabilities, that it's then divided by males more likely than female, Black and students of color more likely than white students. And what number I really want to bring home to you is the majority, or the biggest number, of seclusion and restraint is visited upon our little ones. It's not the middle school, the high school, all the kind of drama and horror stories you hear about. It's our babies that we're doing to it. So please take a really close look at some of those numbers. One of the concerns we have about the new number is that it only counts student heads. So if you were restrained once during the year, you got counted once. If you were restrained 30 times during the year, you got counted once. So I would really love to see us dig down and start to report these as incidents, because they shouldn't be a matter of fact. And although median numbers in the report were like 2 and 3, that's not our experience at either SPAN or the council from the families that we talked to. So I think it's going to be really important to include those numbers, or try to get a better idea of what those numbers might be. I'm not going to pretend to say I understand the median number. There's a reason I was a psych major and not a statistician. However, I know that our experience is that multiple uses of restraint or seclusion is more likely than it being one isolated incident. And a lot of times the one isolated incident is because once it happens to a family and they know it, they will pull their kid. So I don't have any idea, again, data we don't know on how many kids aren't in school because of that, either at the district's hands or at parents or families' hands, in trying to protect their own children from these kind of techniques. So that's another point of data. We have some, other issues. The discipline reports again, are atrocious as far as overrepresentation of males, of students of color. And those tend to, run towards the middle and high school. But both the number of suspensions and removals from school, as well as the number of referrals to law enforcement, I mean, these are all really big problems. What we have missing in this is that students with disabilities are kind of mixed into that. And I would like to see an idea from the data, how many students with disabilities are excluded or referred to law enforcement. We don't have a really good solid number on that. So that's another, and of course, the issue around informal removals, or parents or families that are asked to come get their kid, but without paperwork, is still running rampant. And obviously we have no number on that because we don't have any idea how many kids are being sent home, either part of the day or for full days. But all of these have huge impacts on families and certainly on students, and on their progress and integration into the community. But I want to thank the majority leader, because it was a big enough issue trying just to get those initial numbers. And I thank her from the bottom of my heart that she was a champion of this and helped to make it happen. I think we have a little more we need to do, but I want you to know how much we appreciate the effort. And unless we have, well, actually probably save questions, I certainly will share the links with Mercedes of any of the information or data that I've given. But it's all, available to you, both in your legislative offices or on the record. I have the privilege of introducing a family that wants to talk about, talk briefly about their journey. Kimberly Milligan is a mom from Burlington County, and her little one is all of 4 years old. And she has some information that she'd now like to share with you. Kimberly, if you're ready.
Yes, hi everyone. And I'd like to thank the opportunity to speak today, just to give some background information regarding some things that happened to my son while he attended school in Burlington County. He does have autism and some other sensory processing and some feeding issues that I did speak to the district about prior to his entering the district. But unfortunately, while he was in the district, there were times where he was denied access to his food. There was another time where I picked him up from school and the aide is restricting him by both of his arms. He's pulling in one direction, crying, and she's pulling in another. There was another time where I just picked him up from school and he was placed in the middle of the bench, just as a means of, so he doesn't elope, instead of one of the teachers or the paraprofessionals trying to nurture him to get him through his circumstances, to just left him standing in between the bench crying. There's been times that the teacher has threatened to place him into a blue chair in the classroom. The teacher in the classroom has also mocked his nonverbal wording. There also has been times where the teacher has even said to my son, she had to be careful so she didn't leave any marks on him. There was also many, many days where I picked him up from school and he was jumping off the bench, crying hysterically, running in direction for me. And as we attempt to leave the building, to leave the school, he is just looking back at the teacher and the paraprofessional for the day, 10, 15, sometimes 20 times before we could even leave the building, trying to communicate to me, Mom, something is happening to me here. Something is happening to me and I cannot tell you. And unfortunately, not the teacher, the paraprofessionals in the classroom, or anyone attempted to stand up for my son. They just assumed because he didn't have a voice that he wasn't going to be able to communicate to anyone, that something is happening to me here. Someone is mishandling me. Where I'm at during the day, where I'm supposed to be getting my education, I'm being mistreated, secluded from my lessons, and treated as if I don't matter while I'm at school. And I just wanted to speak today. I'm not sure what can be done or what can be put in place, especially when is entering as a pre-K student and receiving this type of treatment. I could only imagine receiving this treatment when you enter in pre-K and continuing years and years and years go by until you age out. As of now, like my son is afraid to do certain things. We had difficulty getting him out of the house in the morning and fear of him thinking that he had to go back to that school. We did end up pulling him from the school, just trying to get an understanding with the district what happened to him there. Where did the lines fall? Where was the application? Where was the compassion for him? And unfortunately, as of today, I have no answers. I've been communicating with my district. Lines of communication have always been open from my part from the day he came in, to avoid exactly what ended up happening to him. But unfortunately, the school district just is not interested in trying to understand what happened to him is serious. And what happened to him should never happen to any student, whether they have a disability or not a disability. A school is supposed to be a safe environment where a student is able to come, be educated, nurture, and grow. And I just ask everyone here today to just look at our policies that we have in place and just see what changes can be made so where students aren't threatened to be placed in blue chairs as a means of non-compliance. If a student is not able to communicate, them not doing something that you ask them to is not always them denying or being defiant. It's their inability for them to communicate to you. Something else could be happening as to why I'm not able to do what it is that you're asking. Thank you so much for allowing me to speak.
Thank you, Kimberly, for sharing. It's heartbreaking to hear you recount what you're experiencing with your son. And I think you need to know that the people here on today are here to support you and your son and the experiences of many families that we encounter along this way. It's really hard to not say more than that right now, but I know that we'll continue to be in contact with you, and your work at SPAN is important. I would like to introduce our next speaker because I think that there's some answers of what we can do without changes immediately, and I'd like to introduce Fred Buglione. He's the Chief Executive Officer at the New Jersey Coalition for Inclusive Education, where he's been leading that organization since 2014. Fred's organization has far-reaching experience in the area of school discipline and is a recent recipient of a grant awarded by the New Jersey Council on Developmental Disabilities to build capacity in supporting Black and Hispanic communities to reduce seclusion, restraint, suspension, and expulsion in schools by working directly with 3 school districts in New Jersey to introduce best practice strategies. So Fred, I'll let you move the meeting from here.
Thank you very much. And thank you for the opportunity to speak with you today. NJCIE has been around for about 25 years. We're a nonprofit school support agency working with about 150 school districts in the state a year to improve the quality of education for students with disabilities and to increase the availability and access to high quality inclusive education for students with disabilities in New Jersey, the least inclusive state in the country for students with disabilities. I just want to echo what Peg had mentioned, that the reporting on restraints on a per student basis could be improved, and that total number of restraint instances per student would be very helpful. In our work with districts, we have anecdotally heard of very high numbers of restraints in any given week for certain students. So I think that the collection could be improved of that information. And Ms. Milligan, unfortunately, I've heard of instances like this many times. And one of the things that you identified is something that we focus on, which is high quality and effective instruction for all students. And it sounds like your child wasn't necessarily receiving that, and that would have been part of the solution to that situation. We do this, or we provide this support through 2 different projects. The first being the New Jersey Inclusion Project, which is a large grant project in partnership with the Department of Ed that works to support the quality and availability of inclusive education for students across the state. We work with a large number of school districts through that project and really meet them where they are and really work with them in a way that supports their strengths and builds on the positive things they have going on in their districts already. With the EPIC program, which Mercedes referenced earlier, it is a project funded through the Council for Developmental Disabilities, and we are working to create a model in these 3 districts to support the prevention of restraint, seclusion, and suspension from happening. We're working with 30 students who are exhibiting some forms of unwanted behavior and receiving high levels of restraint, seclusion, and suspension. The model we're developing is a collaborative model that enhances the school-parent relationships, empowers parents to become better advocates for their children, and assists students with self-advocacy skills. It also provides ongoing support to teachers through consultation and coaching. We're in the early stages of the project, but the issues that we're beginning to identify, we have seen before. We hold monthly meetings with parents and students, providing them culturally appropriate information in multiple languages on their rights, on communication skills, on advocacy skills, responding to their concerns, and really helping build kind of a cohort of parents who can work together to support their children. We have a behavioral support specialist providing ongoing training to teachers and school staff in the schools. We have constant communication among all of the constituent groups, really trying to facilitate positive communication between the parents and the school staff. And being there, not necessarily as an advocate in the advocate phrase for parents, but being there as an expert and as a support and as someone who translates what school staff are saying, especially in an acronym-heavy profession, into English or Spanish or Creole, depending on the constituent group, in a way that they understand. We're also developing a parent manual on restraint, seclusion, and suspension in multiple languages, and that manual will also be providing a variety of resources to support parent advocacy again and communication with school staff. Solutions aren't always easy. We have 600 school districts and some number of charter schools, and then a whole bunch of private special ed schools. Each student and each situation is unique. There are a variety of approaches that we can use that are research-based and have shown positive results. Non-physical redirection, prompting, mental health counseling, applied behavior analysis, trauma-informed care, positive behavior interventions and supports, restorative practices. All of these things can be used to reduce unwanted behaviors and promote a much healthier and more positive work environment for teachers and administrators. The most important part of all of these approaches is constant communication and collaboration between school staff and parents. Positive and constant communication. There are also other things that other states have done. In Maryland, for example, they have county-run crisis intervention centers. Students facing some form of crisis can be sent to the centers for 60 to 90 days, and then they're returned to their school districts and to their general education placements. All in all, when we go into a school and when we talk to parents who are willing to work together, who are looking to solve the issues, we can get there. As long as we've got that mindset in place that we are all going to work together for a solution, we can find a way to get there using a variety of tools and things that work for that individual school and that individual situation. Thank you. I'm happy to take any questions if you guys have them, and I don't want to run long on time.
Thank you, Fred. Let's hear from members of our legislature or staff at this point. and we-
Mercedes, I'm sorry, I just want to, I forgot that our other priority in having legislative staff and legislative care. I don't want, the one other issue that we wanted to raise was reporting of seclusion. Seclusion is one technique that they can use in schools, and right now it's not required to be reported to the parent. So that's certainly something else we need to fix. And thanks for letting me sneak back in there.
Gotcha, Peg. Members of the legislature, this is your chance to unmute to either ask questions or weigh in on these topics today.
Yes, I have a question.
Yes.
Yeah, so I just want to make sure that I heard Fred correctly. Fred, did you say that New Jersey is the least inclusive state in the country for students with disabilities?
I'm glad you mentioned that, because I mentioned that. Yes, it is the least inclusive. We are the least inclusive state in the country for students with disabilities. Not by a little, by a lot.
And why is that?
So our inclusion rate, and I'm using IDA reporting rates. So 80% of the day or more, that is the amount of time a student with a disability spends in general education settings. That is a placement category that the districts in the state have to report on. 80% of the day or more would generally be considered inclusion. New Jersey's rate of that is 45%. So less than half of our students with disabilities are included in general education 80% of the day or more. The national average is 66%. And there are states out there with inclusion rates over 75%.
Erica, this is Peg. I just want to add that in 1975, when the first Education for All Handicap Act was passed at the federal level, New Jersey was at the top of the game, because up till then, there was a whole lot of states in this country that didn't even allow kids with disabilities to go to school. And we did have schools and placements and kept our kids with a place to go. Unfortunately, what that did was build up a whole kind of cottage industry of segregated placements. So, school for kids with cerebral palsy, a school for kids with autism, a school for kids with spina bifida. So even though for a good reason, we had kids in school, when the law was actually passed, most states were starting from scratch and including their kids in general ed. So, and through that kind of mechanism or timeline, we've gone the exact opposite. And as Fred said, LRE and inclusion is an important measurement, especially for the long-term progress of kids with disabilities, inclusion into their community, into the workforce, into just life itself. So yes, definitely. Thanks for bringing that up, Fred.
So
And
we're
thank
the
you.
only state that includes
If you
less
want to
than
describe what you put in the
50%.
chat there.
Oh, sorry. That is the annual report to Congress on the implementation of the Individuals with Disabilities Education Act. That link will bring you to a PDF, and if you go to page 144, you'll get the grid with all of the information. So we have to report out on 4 different placements. When students with disabilities are included in general education classrooms 80% of the day or more, 40 to 79% of the day, less than 40% of the day, and then out of district placement. We have one of the higher out of district placement rates in the country as well.
Erica, any follow-up on that? Okay,
No, thank you.
you're welcome. Other members, questions, comment?
Thank you for having me.
Thank you, Fred. I'm going to ask if anyone is here from Senator Ruiz's office. Otherwise, I will begin to wrap us up. I know that she had to leave just a little bit before.
Yeah, I'm here for Senator Ruiz.
Is there any comments you'd like to make before I begin to close our session today?
No, I would just like to thank everyone. I think that it's very informative, like the majority leader mentioned at the beginning, that there's always something that she learns coming to these meetings, something new. And I would like to thank the Kim and I forget, it was Kimberly who spoke for her child. It was
Yes,
Kimberly, right?
Kimberly,
Yeah, and
yes.
Kimberly for speaking on their personal experience.
Okay, thank you, Erica. So for our next steps, and just to kind of summarize here, we heard about the need for early diagnosis and intervention for those with dwarfism, Turner syndrome, and other rare disorders, and the need for that. We also heard that until we meet the goal of eliminating seclusion and restraint, because that should be our highest goal, that we need to improve the reporting system. We need to improve the systems of training, advocacy for not just staff, but also for parents, so that we have lower rates, higher rates of inclusion of students and lower rates of discipline in our schools, and targeted, especially in our targeted communities. So I will ask if there's any other members from the legislature who would like to say anything. I want to thank you all for joining us today. This is your open mic time. We've got 4 minutes, and we'll be happy to give them back. Senator McKnight.
Yes, hi. I
Thank
just
you.
want to say to everyone, thank you so much for your advocacy, for sharing your story, and know that I am here to support you in any way that I can. I know Majority Leader Senator Ruiz has been at the forefront, but just want to let you know that we are here to help her, to help you. So thank you for all that you do, and thank you for being a huge advocate and sharing the good, the bad, and the indifference. We are New Jersey. We are New Jerseyans, and we should do better, and we must do better. So let's continue to fight the good fight to make sure that everyone, regardless of any inabilities or any abilities that they have, are standing firm, are supportive, and living life with dignity. So thank you. Thank you for having me today.
Thank you, Senator. So this concludes our 4th meeting for this year, 2024. We will begin again. We have 4 meetings of the caucus each year where we're here for an hour together, but lots of work that happens and needs to happen in between. So our first meeting next year is January 28th, 2025. You will get a schedule for that and the meeting links as we get closer. Thank you all for joining us today. Wish you all very happy holidays, and can't wait to see you all in the new year.